Have you ever mistreated your contacts? You might be mistreating them and not even realize it. Well, in today's video, we're going to talk about eye care for contact lens wearers. Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 8 p.m. What's up, everybody? I'm Dr. D. I'm a doctor of optometry with my own private practice. I did a residency in ocular disease, and now I specialize in dry eye. On this channel, I post educational videos about eye health and vision products. If you're new here, please consider subscribing and make sure to hit the bell down below so that you never miss a video. While you're at it, there are a lot of helpful notes for today's video, so feel free to check out our description below, where we'll have all relevant links and tips and tricks for wearing contact lenses. So today I'm going to be talking about eye care for contact lens wearers. So if you're like about 99% of contact lens wearers out there, it's likely that you're doing something wrong in caring for your lenses. I've been practicing for 11 years and I've seen it all. From patients that literally put their contact lenses in their mouth and use their saliva to re-wet them, patients that wear their contacts for months, if not years straight, with never ever taking them out. I even had a patient tell me once that they made their own solution of alcohol and water to clean their contacts. Big no-no. That is not okay. So the purpose of today's video is to give you some tips and tricks to walk you through the proper way to care for your contact lenses, because in all reality, most people are doing it wrong. So before we really get started with this video, I want to make something clear. This video is for educational purposes only. So at this point, you should have had a contact lens evaluation with your eye care professional. This is not a replacement for that. Just make sure you've had your full contact lens evaluation and have been fitted in lenses. So let's get to it. All right, my pupils, it's time for eye school. All right, tip number one. Wash your hands. This is relevant for before you take your contact lenses out as well as before you put them in. The first step of any contact lens care regimen is to wash your hands. Wash your hands with soap and water for at least 20 seconds. That means you're singing happy birthday twice. Number two, follow your doctor's advice on wear schedule. We've already established that you should have had a contact lens evaluation with your doctor, and every patient has different needs in their contact lenses, and your doctor may have prescribed a very specific wear schedule that's best for your eyes and your eye health. Going along with that, it's really important to know what type of contact lens you're wearing, and by that I mean, what is the wear schedule? Today on the market, we basically have dailies, monthlies, 2-week lenses, and there may be still some lenses out there that are 1-week modalities. What this refers to is the amount of time in which you can wear your contact lenses, right? So a daily is meant to be worn for 1 day and then thrown away. A monthly is meant to be opened, and then a month later, that lens should be thrown away. That doesn't mean you can wear it full time that entire month. Sleeping in lenses is not something I typically recommend, although there are some lenses on the market that are FDA approved for sleeping in lenses. So ultimately, number one, wash your hands. Number two, what kind of lenses do you wear? What is the wear schedule supposed to look like? And make sure that you're following not only the wear schedule that the manufacturer recommends, but that your doctor recommends as well. Number three is to use the proper solution and make sure you're using your solution properly. So let's talk about the two main types of solution. One of those types is called MPDS, or multi-purpose disinfecting solution. MPDS, some examples of that would be BioTrue, OptiFree Pure Moist, Renew. MPDS solutions both clean and disinfect your lenses, but they can also be used to rinse your lenses as well, right? So multi-purpose means that they're doing multiple things for you. So multi-purpose disinfecting solutions, you can take your lens directly from that solution and put it in your eye, and there's no harm done. The way they work is by having disinfecting agents within the solution itself, but they're also formulated to be gentle enough so that you can instill the lens directly after using them. You can rinse your lenses with these, you can store your lenses in this type of solution, you can rub your lenses with this type of solution. This is the type of solution that most of my patients use. The other type of solution is hydrogen peroxide solution. So this is your clear care. There may be others on the market as well, but this has a very specific case where you put your lenses in this little cage-like device, and then you put them in solution, and there's a metal disc that you can see it bubbling, and it basically changes hydrogen peroxide into water and oxygen. That process takes about 6 hours, and so the big difference between MPDS, or a multi-purpose solution, and a hydrogen peroxide solution is that the hydrogen peroxide solution is never, ever, ever to be used directly in the eye. It must pass through that case first. Once it has passed through that case and is neutralized and is essentially just a saline solution, now you can use that to rinse off your lenses before they're put in your eyes. If you've ever used hydrogen peroxide solution directly in the eye, comment down below and just tell me about how red your eyes got, because it will definitely cause some redness and irritation. Now, when you're using solution, most people don't realize that you must have fresh solution every single day. Because you're relying on that solution to disinfect the lenses, there is an inactivation of the components that disinfect the lens with use. And so you certainly don't want to just top off your solution and put your lenses in every night. Empty that case out thoroughly, just completely dump it out and rinse it out in the morning when you've put those lenses in, and get fresh solution every single day. All right, next I want to encourage you to actually clean that case with soap and water at least once a week. This will make sure that you're getting rid of the biofilm that can form. Biofilms are everywhere. We form them on our teeth. That's what plaque is. We can form them on our eyelids. I have other videos where I talk about that. And certainly a biofilm can form within your contact lens cases. That can be harmful to your eyes, to your comfort wearing your contact lenses. It could cause infections. And so cleaning that case thoroughly and getting rid of that biofilm is very critical. So it's also important to know when to call your eye doctor. When you wear contact lenses, if you ever have redness, sensitivity to light, vision changes, or pain, take your lenses out right away and give your eye doctor a call. Let's talk about a couple of special circumstances. I get these questions all the time. So, question 1, can I wear my contact lenses while swimming? If you're swimming in a pool, it would be best to wear goggles and try and keep your eyes closed as much as possible while wearing contacts. You really want to avoid water. We don't think of our water as being dirty. Of course, we drink it, so how could it be dirty? But in fact, there are pathogens that can exist even in filtered water that can cause major, major problems in the eye. One of those is acanthamoeba. Acanthamoeba is especially problematic because it can encapsulate itself and survive some pretty harsh environments. That's the big one we worry about when we find out that patients have been storing their contact lenses in water, swimming in their contact lenses, whether it be in a pond or lake or pool, or a hot tub, which is the next question. Can I wear my lenses in the hot tub? I would not, and if you do and water splashes in your eye, I would remove that contact lens immediately and really watch yourself closely for those symptoms of redness, sensitivity to light, vision changes, or pain. Another question I get is about cosmetics and aerosols. So in theory, it would be nice to get your hair done and your makeup done before putting your contact lenses in. That way you're not exposing your contact lenses to more chemicals, possibly the debris from makeup as you're putting it on. Finally, make sure not to store any contact lenses in the car. Heat is not great for them, and that could be setting you up for eye infections as well. A couple of more thoughts about caring for your contact lenses. Ultimately, you're trying to wear them. What's the goal? You're trying to be safe and healthy and have clear vision and comfortable eyes. The way you achieve that is wearing your contact lenses on the schedule that your doctor recommends. taking them out every night, rubbing them and cleaning them properly per the manufacturer's recommendations, storing them in clean solution, storing them in new solution every night. Don't share them with your friends. Don't store them in something other than contact lens solution. Don't overwear them. You know, most of the patients that I've seen that have complications from contact lenses, something has gone wrong with the wear schedule. Either they're sleeping in them every night, or they're trying to make them extend way past a month or a day. And that's when we start to see complications occur. Because ultimately, remember, a contact lens is like a sponge. It will absorb whatever it comes into contact with. And so that lens certainly becomes less and less breathable over time, and your corneas need oxygen, atmospheric oxygen. Any contact lens is like a barrier to that oxygen. So when you start abusing that contact and making it even less breathable, your corneas aren't able to breathe, which is setting you up for an eye infection. I've seen corneal ulcers, I've seen infiltrates within the cornea, which are kind of a precursor to an ulcer, and I've also seen contact lens associated red eye. GPC. I've made a video about GPC in the past. So if you don't take great care of your contact lenses, there are a lot of bad things that can happen, leading all the way up to blindness. It is very, very worth it to take that little bit of extra time and care for them well. In conclusion, listen to your doctor. Ultimately, talk to your eye care professional. And when I say talk to them, tell them how you wear your contact lenses. I know that that's the scariest thing in the world, but when my patients actually tell me how they're wearing their lenses, A, I can correct the things that are really wrong and harmful and are gonna potentially lead to infections and problems, and B, I can better match you in a contact lens that matches the way you wear your lenses. Meaning, if you sleep in your lenses, tell your eye care professional. We're not gonna just take them away from you. We're going to educate you, and you can kind of steel yourself for that conversation. But ultimately, if you give me good information, I can put you in lenses that are going to work the very, very best for you. So I appreciate when patients are honest about overwearing or sleeping in their lenses, because guess what? We can, all right, if that's how you behave, I can match that behavior. I can put you in a lens that can withstand your behavior, but also maybe meet in the middle a little bit and change some of those behaviors as well. So thank you again for tuning in. I hope that this was helpful to you. It was just kind of a frank conversation with you about what I've seen in terms of contact lens overwear. I tried to give you some great tips of better ways to wear your contact lenses to keep your eyes safe and healthy. Make sure to like and subscribe. We're here every single Wednesday, and I will see you next time. Okay, thanks, bye.